Hi, 7th graders. Today we're wrapping up 6.4, Infectious Disease in Your Health. We'll finish learning how to prevent infectious disease and we'll do a little bit of review. So I've got a couple questions for today. What is tuberculosis? How are viral diseases prevented and treated? And we'll do a bit of review. So what's tuberculosis? Well, it's a bacterial infection that is infectious, can be passed from person to person through coughing. And it's something that affects the lungs, it affects your respiratory system, among other things, if it gets really bad. And it used to be a real killer of people. It used to be very common. People died from it more than people died from the war. But it's not so much a problem anymore. And that's because among healthier lifestyles, more hygienic practices, there was also a huge public health campaign to get rid of tuberculosis. Even before a vaccine was invented for tuberculosis, people were able to identify it, and what they did was they actually isolated people who had tuberculosis, right? They were doing some quarantining and distancing of people who had tuberculosis, and that prevented the spread. It worked really well. And then when an antibiotic was created in shortly before the 1950s, tuberculosis all but disappeared. It still exists today. It still happens. People can still get sick from it. It's very rare in more developed countries. It's a little more common in countries with lower lifestyles or not as good of healthcare systems. But it's not the same killer it used to be because of antibiotics. So I talked a little bit about the dangers of overusing antibiotics. But antibiotics do save lives, okay? And here's an example of how. So when we talk about viral diseases don't have the equivalent of an antibiotic. Yes, we have antivirals, but they don't always work. And they don't always work well. Sometimes they work, sometimes they don't. There's not really much medicine out there to kill viruses. For one, viruses aren't a living thing. So what are you going to attack? They don't have a cell wall. They don't even have cells. Okay? So you have to figure out how to stop them once they've already infected your body, right? How can we stop them from multiplying and taking over our cells' resources? Most of the time, all you can do is reduce symptoms. It's like taking cough syrup. I mean, you can take care of the cough, but you're not stopping the rhinovirus. You just sort of have to let your body fight it. Like I said, there are antivirals, and there are some promising treatments, and people are looking into other things like gene therapy. But right now, viruses are one of the hardest things for us to treat. And so we make vaccines instead. We talk about prevention. Okay? So how do we prevent viruses from spreading? Well, obviously we don't want to come into contact with infected people. We wash our hands. We make sure our body is strong so that if we do come into contact with a virus, maybe it won't hurt us. We try to keep a balanced diet. We try to exercise. And when it's available, we take the vaccine, but vaccines aren't always available either. So the most important things are the prevention that you can do. So I've got a few questions for you to think about. Why haven't we cured HIV and the common cold yet? Now, there are some promising treatments out there, and people are doing research on this, and hopefully someday we can. But we haven't done it yet, and I want you to think about why that is. Also, how do doctors and public health officials prevent and treat viruses? I just talked about that, so hopefully you should be able to answer this question. And why are infectious diseases and antibiotic resistance public health concerns and not just personal health concerns? So when you get a genetic disease, it's very sad, but it's more of a personal health concern. Why is it that something that's infectious, or even worse, infectious and antibiotic resistant, more of a public health concern. I want you to think about that. So let's review the main ideas. I'm going to ask 9 questions. After I read each question, I want you to pause the video and see if you can answer it for yourself, and then unpause it and I'll go through the answer. So number 1, describe the 2 ways immunity can be developed. Well, there is, when you want to acquire immunity, there's 2 ways to do it. Active immunity, right? And this is immunity that you develop after being exposed. So it can be natural, right? After getting a first infection, your body creates antibodies. Or it can be artificial, where you get a vaccine and then your body creates antibodies to respond to the vaccine. Or it can be passive immunity, where you acquire it from someone or something else. So the natural way is transmitting antibodies from the mother to the baby, right? It could be through the milk or through pregnancy. Or artificial, when you give a serum transfusion. Say one patient recovers from a virus, you can actually take their blood and give their plasma to another patient that has the virus, and it gives them more antibodies. Number 2, draw a model to explain the mechanisms of active immunity. So when I say mechanisms, I just mean how does it work? Well, let me show you. You start with bits of a virus or a bacteria coming into the body. Your body recognizes it. Your B cells, your T cells recognize it. And what they create is memory cells that are specific to that pathogen. So that if it ever enters the body again, if there's a second exposure, they respond right away and start to multiply and create many, many antibodies. Number 3, explain how vaccines lead to immunity. Okay, so you receive a dead or weakened version of the pathogen, or maybe you receive parts of it, just parts of its protein outer coat. That gets inoculated into your body, so through an injection, for example. And then your body starts to create memory cells and antibodies that recognize it, providing you with long-term immunity. So if that does show up later, your body recognizes it and attacks it. Number 4, why is the immune response to a second infection faster than the first infection response? Remember that during the first infection, your body has to build up the antibodies and the memory cells. It doesn't have them the first time you get the infection. However, those stay in your blood after the infection at low levels, but they're there. So that if you get it a second time, they respond immediately, very quickly, multiplying and producing antibodies. Number 5, how is passive immunity established? Remember, this happens 2 ways, either natural through maternal antibodies or by receiving a blood transfusion, a plasma transfusion from another patient who's recovered. Number 6, how are bacterial diseases treated and how does this work? Remember that bacterial diseases are treated using antibiotics. And those work in many different ways, but the main idea is they pick one part of the bacterial cell and then they attack it. They have to pick a part that is specifically bacterial so that they don't accidentally attack our cells, right? You want to make sure it attacks bacterial DNA, bacterial ribosomes, bacterial cell walls, so on and so forth. Number 7, how has antibiotic resistance evolved and why should we be worried about it? Well, remember that sometimes resistance just occurs naturally. Bacteria are mutating all the time. They get all kinds of crazy mutations. They just change quickly. And some of those mutations might cause resistance. And if you have some of those bacteria that have the resistance in a large infection, right, your antibiotics will kill off the bacteria, most of them, but not those resistant to the drugs. Then those resistant bacteria have space to multiply. And they can even transfer their drug resistance to other bacteria through conjugation or transduction. And this is a problem. It's a public health concern, right? Because We have historically overused antibiotics. We use them too much. We used to. We're trying to do better now. We give them to patients whenever patients ask for them, right? Which we shouldn't do. Like, if you have a cold, you shouldn't be taking antibiotics. You don't need them. A cold is a virus, not a bacteria. We use them in our meats. And what happens if resistance is developed, for example, in meat, okay? If that meat isn't cooked well or not handled well or something else happens, right? Those bacteria can reach the humans through the food or the environment. Okay, the other pathway, right? If we're giving people antibiotics that they don't need, right? And they develop, their bacteria develop antibiotic resistance. Those bacteria can spread to other patients. Number 8, what has happened to tuberculosis over the past 50 years? Remember that I said it used to be a very big killer. It killed many, many people. But, and here's the bright side of antibiotics, we developed medicine. And before that, we developed ways of testing for tuberculosis and isolating people. So even before all of this was identified, even before the bacteria itself was identified, people were starting to live healthier lives and cleaner lives than they had before, reducing bacterial diseases just in general. Once we were able to test for it, right, we were able to figure out who has tuberculosis, isolate them away from healthy people, reducing it even further. And then when we developed antibiotics, tuberculosis all but disappeared. This is my last question for you guys. How are viruses treated and prevented? So remember, prevention is the most important thing, right? Washing hands, using tissues, not touching your face, avoiding contact with sick people. We can take antivirals if they're working, but remember, not all antivirals work, not all the time. And there are actually antiviral resistant viruses too. So a lot of the time we end up treating the symptoms, right? Trying to keep ourselves healthy, our bodies healthy, so that our body can fight the virus on its own. Well, that's all I've got for you for this section. I hope you learned a lot. Make sure you do your work.